Good afternoon and welcome, everyone. My name is Lynn Duran. I'm the Assistant Dean of Student Affairs in the College of Public Health. Thank you so much for joining the virtual MPH Practice Applied Practice Conference Student Highlight event. We're so excited to have you all with us today, including current students, faculty, preceptors, and prospective students. We would like to take a moment to respectfully acknowledge the University of Arizona is on the land and territories of Indigenous peoples. Today, Arizona is home to 22 federally recognized tribes, with Tucson being home to the Atam and the Yaqui. Committed to diversity and inclusion, the university strives to build sustainable relationships with sovereign Native nations and Indigenous communities through educational offerings, partnerships, and community service. As you may know, our Master of Public Health students from the Tucson, Phoenix online and global MPH programs conduct applied practice experiences in communities around the world. The applied practice experience serves as an integral part of the MPH degree curriculum in which our students are able to utilize their academic knowledge from the classroom in real-world practical situations among professionals in the public health workforce. We are so profoundly grateful for the collaborations between our students, faculty, and agency preceptors, and are very proud of the contributions our MPH students have made to the field of public health. The Virtual Applied Practice Experience Conference is our opportunity to showcase the program, showcase the breadth and depth of public health work that our MPH students have done with local, national, and global communities. Coming up next, you'll hear from some of our MPH presenters and learn more about their amazing experiences. After our student panel, we will provide some additional details about the conference and how to view our fantastic student presentations. Thank you.
Hello, all. My name is Kim Barnes, and I'm the Director of Student Affairs for our Phoenix campus. With us today in the audience, we also have Vanessa Perez and Mariah Alberti, who are my co-MPH coordinators for our Tucson and online campuses and have worked hard to make sure we're all here today. But we're very happy to welcome our student panelists here today. We have Laurel Burnham, Shelby Hoffman, and Lisa McClellan. They're all from the online MPH program, different concentrations represented. And our panelist bios are included on the conference presentation webpage, which we'll be sharing later, so you can learn more about them and their backgrounds. We really just want to jump into questions to learn about their experiences today. So I'm going to start us off with some questions, and then we'll be able to open it to the audience to ask questions, and then we'll close and wrap up with some information about the presentation webpage. So without further ado, again, Lisa, Laurel, and Shelby are here today, and we're going to start with a super easy question, I hope, which is, can you briefly describe yourself and your applied practice experience? And if anyone wants to volunteer, that's fine. I can also call on folks, so it's up to you guys.
I can go.
Okay, thanks, Laurel.
I'm Laurel Burnham. I am a little bit about me. I'm an infection preventionist here in Tucson at Northwest Medical Center, but my background is microbiology. My internship or my applied practice experience was about an intervention that we put into place at my facility in the middle of COVID to try to decrease the number of hospital-acquired infections we were seeing in our ICUs. And so it was a lot of data analysis and chart review and things related to that intervention.
Thank you, Laurel. I think we'll pass it to Lisa.
Hi, my name's Lisa McClellan. I'm a family practice doctor by background, and I'm in a leadership, physician leadership role at Phoenix Indian Medical Center. And my applied practice experience was at Phoenix Indian Medical Center, I.H.S. It was beyond my regular scope of work and duties. And I did a look at what we were doing with our patients who had diabetes and an A1C above 9%, which is above the goal of 7%. And basically, it was a process improvement plan project where I looked at what we are currently doing, held, well, I won't go into all the details, but then came up at the end with some recommendations for some process improvements through a PDSA project.
Thank you, Lisa. Yeah, we're going to dive into the details and hear more about the projects here coming up. I know you all are so excited. You're ready to share. Shelby.
Hi, yeah, my name is Shelby Hoffman. I actually have a background in child and maternal development and health, and in the Health Services Administration concentration. My internship was with the American Association of Birth Centers, and so what we were looking a lot at was maternal health care outcomes, particularly within military and TRICARE patients, and sort of cross-referencing that with maternal health care deserts, and trying to figure out how you have TRICARE who doesn't have accreditation for birth centers, and how to sort of collaborate that. And again, we'll get into details. So
that's great. I'm also so excited for folks who are here today. Make sure you, first thing you do after you leave today or early tomorrow is watch the presentations for these three folks. You're going to learn about them today, but it's going to be great extra information. I watched them all yesterday and they were fantastic. So one question we get a lot, both from current students and from folks here today, is how did you find and secure your applied practice experience? And were there any particular challenges you faced in the planning process?
I can jump in. Mine was actually a very, very interesting process, because I had started to reach out to different locations that were sort of offered to me through the University of Arizona. And my particular supervisor I had reached out to, and she was like, no, we're not really doing anything. And so I was like, okay, well, here's my cover letter, here's my resume, here's my background and everything that I've got, and sort of what I'm interested in. And apparently it worked, and it piqued her interest. And she was like, actually, hold on a minute. And the next week we were on a call, and she's like, I have this project. It seems like it's right up your alley. Let's do it. And so I don't know, moral there, I guess, is even if it doesn't seem attainable, try. So.
And always have that resume updated. Be ready to send that, right? So you can secure it. I love that. I love that you were able to make a connection with a previous posting and really be able to sell your idea and find that great fit. That's amazing. Lisa.
Yeah, for me, because it was at my place of work, I had some ideas of things that I thought I wanted to do, but as I talked to stakeholders, they said, yeah, that's nice, but we want you to do this because this is something that we've struggled with, that we've never moved the needle on this. And so then I had to kind of go back to the drawing board about how can I do something around this particular topic. They said, we have all these patients with an A1C above 9. For years, we haven't made any improvements despite our best efforts. And the other things that I proposed to them, they said, no, we'd rather you do this. So, even though it is my place of work, I kind of listened to the people in the community about what they thought the need was and focused on that.
I think there's a really important lesson in there, which is that, especially in worksite projects, there's a balance, finding a balance of, I want to do this project for my master's degree, but I know you need things. And so let's figure out where we can meet in the middle so I can make sure I'm getting new skills and developing my skills and also doing something that serves the organization. And sometimes that's a little bit of a gray area we like to iron out if we can, but it seems like you did a really good job walking that fine line between what you really wanted and what could really be helpful to the organization, which is great. Laurel.
So my internship was also at my place of work. It kind of was being an infection preventionist during COVID-19 was, I don't even know how to describe it, but it was kind of intense. And you're trying to make decisions, to keep people safe and to do these things. And so we kind of made this intervention decision as a facility, to really try to help the patients that we were seeing to not have all of these HAIs, but we didn't have the bandwidth as infection preventionists to sort of see what the outcome of that was, right? Anecdotally, we saw numbers go down, but we didn't have any data that went with it. So that was really kind of where it came out of, was like, we want to know what did this really do any good? Or like, I mean, we know it did good, but like how much and how can we quantify that? So it kind of evolved, you know, after being through the experience of like, okay, well, now we've got this great thing we did. Let's see what you know, what came out of it.
And Laurel, you secured IRB approval for your project, correct?
I did, yes. I was the principal investigator and I had to do full human research retrospective IRB approval, which took a very long time. But because I kind of already went into my MPH with this idea of wanting to do a project at my facility, I started way earlier than they really tell you to, but I knew that it was going to take a while. So I started actually the process, I think, in my second semester, which is not usually when people start their internship stuff, but I just knew all this stuff, you know, it just takes time. So
it does. And thank you for that. I think what's so interesting too is that when you speak about that data piece, right? Again, we know anecdotally things got better. We noticed they got better, but you can't make decisions, future decisions on the we noticed. It's much harder to make those decisions, right? So I know all of your projects had some element of that data piece in there, which I think for organizations, whatever they might be, hospitals or other organizations, having that data, you know, it sells it to them, they can sell it to other people, and then you can turn it around and use it to do really great things. So that important of that data piece. And sometimes that data comes with IRB approval. And so, yeah, it's really important to build that into a project if it's going to need it and not skirt around it to avoid doing the IRB. And that's really a lesson for students in the audience more than it is for you all, but it's an important one. So thank you all for sharing that little bit about how you found your projects, very different ways, hubs and connections, workplace, and sort of, I knew this is what I wanted to do this, which is atypical, but also super valid and an amazing way to find an experience. So I would love it if each of you could share a little bit, sort of describing any unique experiences you had during your applied practice experience. And by unique, I don't mean like necessarily super big surprises, although those are fine as well, but things that you found particularly challenging or special or eye-opening for you.
Yeah, I'll say that I felt like, because it is kind of it is within my realm of work and influence what I was looking at, but not at this level. And I was surprised how engaged everyone was. As soon as I started asking questions or saying, I want a survey, or can you share with me what you think is going on or what you think we should be doing? Everyone was I really didn't get any, I thought there might be some apathy or, oh, Lisa's in school, so we have to do this kind of attitude. But people were really excited and they were very motivated. And because it was patient-centered, you know, that at the end of this, there are patients and people's lives and it affects morbidity and mortality. I think, and these are frontline folks who are interacting with them, I think they felt very inspired or maybe hopeful that, oh, we're going to get better at this. And some things actually, I don't know this for sure because we haven't had enough time to kind of look at the PDSA cycle, but I think some things started to just kind of naturally improve just because there were eyes on it. Which is how a lot of things work, I think, too. So I think, yeah, people felt inspired, I think.
I think that's really great. I think we overlook or underestimate that sometimes folks just need to be able to talk about something to get reinvigorated about that thing, right? Because we're all doing our tasks day to day. And sometimes when you bring attention to, hey, what about this? It's like, oh, you know what? Maybe we can. One thing that I really liked in your presentation, Lisa, is something that you said, which was that avoid looking for simple solutions because these are complex problems. And that really struck me because I think sometimes we do I'm going to say the phrase, nobody wants the phrase, right? But low-hanging fruit as a first way. And you were sort of like, that's not going to cut it though. This is a complex problem. It probably has a complex solution. And I thought the way that you talked about your collaboration in there, getting people excited and engaged is a great way to come up with things that maybe are more complex.
Thanks.
Yes, that was really great. Shelby.
Yeah, so I mean, I think something for me that really stood out in my project was one, how expansive it actually wound up being. So part of I went into this sort of looking at it from a literary analysis and sort of looking at the research and really taking a peek at those numbers. And it developed into so much more. I wound up making like an entire overlay map of maternity healthcare deserts compared to military installations. And then that actually wound up making its way up to like senator and representative level and sort of got passed along all the way up that sort of chain. And it wasn't until I was like sitting in on a call with these people and my supervisor and like I had a moment mid call where I was like, wow, like it just, I think you feel as a student sometimes that you can feel small, even when it seems like something that you're doing is big. And I think that for me was a big moment in my internship where I was like, okay, all right, this is great. So
I love that. I love the map too. I was like, wow, that's a map.
I can pull it up, I mean, at any point, but yeah, it
was complex. And I love that for you, how you were like, this matters. I think we all want to have that moment where we're like, this work matters. I mean, we're in public health, and so we want things to matter and be impactful. But sometimes in the classroom, you don't necessarily have that experience, right? You're doing classwork. And so to have the moment where it's like, oh, this matters, feels great. It just, I'm sure you left that call saying, oh my gosh, this was great, right?
Absolutely. Absolutely.
That's fantastic. I love that. Okay, so on the flip side of that question, because I feel like you all gave pretty positive answers there, were there any moments where you felt like oh my gosh, this is going to break me, or this project is going to, and then you had to pivot, like a challenge where you really had to pivot yourself in the project?
I have a pretty good one. So as I was starting to do these chart reviews, so the project it was around hospital-acquired pneumonias and ventilator-associated events. And identifying those takes an intense amount of chart abstraction. And I kind of underestimated how long each one would take. And so I didn't end up with as really robust data set as I would have hoped. So unfortunately, some of the relationships that I did identify, it's kind of weak because I don't have a ton of data, but it was a really good experience to still do the data analysis and like try to figure out how to code this and, try to figure out how to do those things in the future. But I also really learned why projects like hired chart abstractors. That's all they do. Because it was just hours and hours and hours of work, and time spent away from my family. And so that was really hard, because I really had to focus on those. But yeah, I mean, you get through it, and I kind of had to find a stopping place and be like, well, I made it this far. I got to do the data analysis. So I can't, so some disappointing features, but I still think overall a really good experience of trying to figure out, how can I slim this down? How can I make this faster? How can I do it faster? Kind of thing. So.
Well, and think about this now. Now you have the bones set up for this study,
yes.
Right? So if you ever, if Northwest Medical Center is like, hey, we have all this money, then you could hire these chart folks to do the work for you, right? Because you would know. I'm sure that will never happen, right? But
right.
But what needs to be done, and I think that's a really important piece, because often I think agencies and organizations aren't doing this important work because it takes time and effort and money, and the folks on the ground already don't have enough of that. We had someone, I think, in our last panel also share about, she was doing a qualitative research study, and the time it took to listen to the interviews, to code everything, again, is vastly underestimated. Yeah. Lisa, did you have any pivot moments?
Just I was reflecting on in a really large organization, which we have, I think, 1,500 employees, and then we're part of a large agency. So when you kind of start to look into a complex problem and you start talking to a lot of different people, they might point you in a direction that is kind of their preference, and you could kind of end up in a rabbit hole of, you know what we really need, this came up and it was a good suggestion and a good idea, but what we really need are these health coaches. We need somebody to spend this time with the patient, and it's not absurd and it's a real thing. And so then I started off on this rabbit hole of we need to get them some health coaches. And it is something that I could kind of be involved in, but it's actually out of my lane. It really is in a completely different department. And there were already a group of people working on this kind of thing. But I was just reminded that, okay, now stick to what you were going to do that's in your lane. And people have their pet projects or they have their preferences about what they might think, what direction they think you might go in. But it can be a little distracting and could lead you to some other pathways that were not your original journey. So, I mean, you kind of have to go look down them to see if that's where you want to go. But I thought that was interesting in talking to a lot of different stakeholders that I would periodically, get somewhat Don Quixote about the whole thing and go chasing after something and then realize, oh, I need to get back on track about what I'm doing here.
Yeah, that excitement we talked about leads to great ideas, but sometimes those ideas, again, rabbit hole us, derail us. And I think that's an important part of the planning process for your experiences. Having that documented plan really helps you be able to come back and say, this is what we're going to focus on, right? It's that syllabus piece. Or some folks pivot and make changes because that's what makes sense. But I think oftentimes, especially on a super collaborative project like yours, Lisa, idea development is important, but you can only do so much and you have to get back to where you were focused on, which can be a challenge in negotiating that, particularly in a workplace project, because you're there, you don't leave there and it's your full-time place. So I think that's really important. So a follow-up question for that. So obviously these are applied practice experiences. They're part of your MPH degree, right? This is not just a standalone project. What, if you can think back, I know you're all three almost done, so things might feel kind of far away, but if you can think back to some of the skills or knowledge from your classes that you felt you really brought to the table in your experiences or things that were emphasized for you, I think that's a really helpful thing to share here. If there's anything that you were like, oh, I'm so glad I had X, Y, or Z in this class.
I was actually thinking about this question today. And for all those applied epi students that may or may not be watching this, if you're using Stata or any other statistical application, please learn how to do files. I didn't learn them until this very last semester with Dr. Lobita Woodson, and that changed my data analysis game tremendously. So I wish I had learned it a little earlier, but that was just something that totally, elevated my skill set to be able to do my data analysis efficiently.
Oh, that's fantastic to know. That's great program feedback too. Thank you. Lisa or Shelby?
I think for me, and a lot of times I think in these classes, it seems small, but I think the emphasis overall on the collaboration, the group work, the working with so many moving parts, I think for me, I mean, there were a lot of intricacies with research and whatnot, but I think the big overarching one for me was that emphasis on really being able to work with just about anybody in any time zone, because that was also a big thing, because I'm on the East Coast. So that was definitely helpful.
That's great. I know folks are either teamwork or not teamwork, right? But you don't get out of it in an MPH. You just don't, because you can't. That's not the way your projects will be. And learning how to work with people you don't know is really important. Yesterday, when we had our little chit chat, we realized Lisa had been in a group with Shelby and Lisa had been in a group with Laurel. And so crossing concentrations. And I think that that's really impactful to know how to do that. It's a skill to be able to come together and do something quickly as a team that you don't know. Lisa, what about you?
I think quality, I felt like I knew a little bit about quality coming into this, but I think having a much more depth and a broader understanding of quality process improvements. I've been through PDSA cycles, but to study it at an academic level and then implement it into a program was really meaningful for me. And then the other area would probably be, we in several different classes talk about stakeholder analysis. And I think at first glance, it seems like it's intuitive, but the deeper you dive into that, you realize, no, I'm leaving somebody out. And, it's the worst thing to happen in a project, to leave somebody who's really key out, and then you're trying to get them to catch up and you're 6 months into this thing. So I think getting that right up front was kind of brought home to me in this process too. And some other things that are in my presentation, all from healthcare administration and quality.
Yeah, the stakeholder piece was a big part for you, right? Because there's so many people that have to come together for this. It's not just care providers, it's not clinical providers. Well, it's a whole bunch of different clinical providers, and then some of the social care aspects of it. So it's really important. It's really interesting. Laurel, your project, I found it really interesting from your perspective. Down in like one of your last few slides, you talked about the social determinants of health really not being a part of what you needed or not being impacted. Can you talk a little bit about that?
Yeah, so it was something I never really thought about until I, became a student in the MPH program. But I think that hospitals across the country are sort of missing a mark when it comes, and I'm an infection preventionist and a microbiologist, so I always think HAI, right? But there's tons of different quality indicators that are inside healthcare. And the government, our CDC and NHSN, they're not to the point where we're really looking at, how our HAIs being connected to the social determinants of health. And then what are we doing as facilities to help them, right? Like we're not identifying, who's at higher risk for a CODI or a CLABSI or another hospital-acquired infection. So how do we know how to help those people, right? So I think there's a huge space. It's an empty space, that's not, that I think, healthcare really needs to start thinking about those things, in the day-to-day business of running a hospital, and keeping our patients safe.
Yeah, I had a conversation with an alum a few years ago. She was an MPH alum, and she had done an administrative fellowship, health administration fellowship after her MPH. And she was the biggest proponent of having MPH students in those administrative positions, in addition to health admin folks directly, because she felt like the core MPH courses brought more of the social determinants of health than just an MHA might. And so she said, we need more of this in the hospital settings, in every setting, quality improvement, ambulatory, all of the pieces. It's an important, and really, for me to hear you say, because you're dealing with infections, to hear it be like, we need social determinants of health. And it was like, oh yeah, we do. And so it was really great. I love that you recognize that piece of it in your project. It's excellent. Okay, so now a question, a little bit of a backup question. What do you feel like you learned about yourself during this experience? That might be a harder one to answer, but what did you learn? I see Shelby's going, uh-oh, Kim, thank you. But what did you learn about yourself during this experience?
I think that I learned I'm more resilient than I really thought I was. And I kind of always thought I was pretty resilient. But it definitely made me, sorry, I'm going to kind of tear up about it, but it was a really impactful experience to have to spend so much time on my MPH. And, I'm an older student, so, I have a little person at home, and to make the decision to kind of not have as much time with him, but still find the time together. And when I could make the time for him, just making sure that that was really valuable time and that he felt loved. And so I just moved through that a lot smoother than I thought maybe I was going to. I thought I was gonna, not that I didn't have moments of like probably losing my cool, but I think that I really came out way more resilient on the other side than I expected, for sure too.
Yeah, I think that's really powerful, Laurel. Thank you for sort of being a little bit reflective with us, because I think that is so true. We learn that we can do hard things and you can find the balance. And like we were talking about before this call, started. 2 years was both the longest 2 years and also very fast 2 years. And realizing that you can do hard things is really pretty special. Lisa or Shelby?
Yeah, I think I spoke about this in my presentation, and we already kind of reflected on it, that some of these public health problems, most of them, are really complicated and really complex, and they have so many different factors weighing on them, and some of them we don't even realize. We know about these, but we don't know about those. And I have a kind of take take no prisoners approach to a lot of my tasks at work, because a lot of them come at me pretty quickly, and I've, like a lot of people, it's just every day is busy, every week is busy, every month is busy. So sometimes I'm always looking for a quick and easy solution to whatever's brought to me. And in addressing a more complex public health problem that people bring to you and say, you know what, I mean, they're talented, smart, professional people who have already put a lot of work into trying to solve this problem on their own. And they're coming to me and saying, why don't you look at this and see if there's anything that we're missing or something that we could do differently? It made me appreciate that doing that deeper dive, taking time to get all the stakeholders together, think outside the box, get ideas from the front line. It took a lot of time, and a lot of the solutions or suggestions were good. They just weren't as feasible at the time, at the moment. So, we ended up going with something that was more feasible for right now. But anyhow, it just made me reflect on, maybe don't always look for the quickest thing. Everything doesn't have to be lean. Yes, lean processes are great, but sometimes it's just going to be a big fat process, and it's not going to be lean. Sometimes it's just going to be really fluffy and a lot of things to kind of work through. So it made me reflect that, I could roll up my sleeves and tediously, painstakingly go through a lot of details and a lot of information, and really try to find a solution that isn't easy.
Sometimes the answers are chunky, right? They're not lean, they're fluffy, like you said. And we have to, forgive me the word, we have to lean into that a little bit sometimes, I think. Shelby, what about you?
Yeah, I mean, I think my experience is very similar, just to sort of bounce off of what Laura and Lisa have said. I think my route is more of I was really able to identify my resourcefulness. I am not a graphic designer. And so when my supervisor came to me and said, hey, we have these two things, what can we do to sort of combine them together? And I said, oh, how about an overlay map? She's like, yeah, run with it. And I was like, oh, like I have never done that before. I don't, have that background, but okay. And I think my ability to, because at that point I was like, okay, I have contacts in the military. So I reached out to them and was like, hey, can I get a list of all of these installments, all of the military bases, and was sort of able to pull that, take my knowledge of, what's been reported as far as maternity care deserts go and combine them. You definitely have that moment at the end of it where you sit back and you're like, okay, I did this. And so I don't think you realize your potential and your capacity and your resources that you can access. So
I love the truth of that, which is that sometimes the things we come out with at the end are the things that were hard and that we didn't know we were going to do, and we didn't know we could do. And sort of that like moment of, wow, the resilience and the learning to slow down. And then okay, I've been handed this thing. How am I going to do this? I think those are things that we don't always think about in the classroom sometimes, right? Or, you have a rubric, or you might have something like that. But here you are sitting by yourself, maybe saying, oh boy, and here's how I'm going to run with it. And that's just an incredible skill to have to develop and to need. So thank you for that. Okay, so question. What was your favorite part of your experience? What was like your favorite thing that you did, or moment that you had, something that you just walk away and you're like, oh my gosh, I'm so glad that was part of what I did?
I'll jump on this one. I think so part of my project was developing an entire narrative, and it is like this close to being published, which is great. And I think like that big moment was, you know, you edit, you send, they bring it back and say, fix this. And the moment that you send it and they bring it back to you and say, all right, it looks good. That for me, I think was a big moment. So
the I'm ready to be done moment, but that I did it moment. Yeah, that's great.
Yeah, because you like go back and forth, back and forth, back and forth. So
yeah, that's fantastic. That feels great. I think any researcher in the room knows probably how that feels, right? To finally get the rubber stamp. Lisa and Laurel.
I would say the one-on-one conversations that I had with people, interviewing individual people instead of meetings, people shared things that they may not have felt comfortable sharing maybe in a meeting setting. I got to know some people in the organization and in other departments I didn't know as well. And I found that really rewarding. And I have a lot of one-on-one conversations all day, every day, but not with that particular group of people about that particular issue. And to do that longitudinally over a long period of time, okay, I asked you these things, and now we're kind of thinking that this is where we're going to go. Now, what do you think? And I really enjoyed that. So I liked, and it kind of goes along with my personality. I'm more of an outward-facing person than introverted. So I really enjoyed that part of the project. I think that's important for other students to realize too, that, you know, although it's public health and you think that, you know, maybe you go to an organization that you're not part of your organization, you don't know anyone, but if you're tackling a problem that they're aware of, or that they're not aware of, generally speaking, they'll be very excited to sit down and speak with someone about, hey, I'm so glad you're looking at this. I've always wished that somebody would take a look at this.
And I suspect, Lisa, that they were equally as happy to talk about it too, right? Like that this is not, it's not just you were excited, somebody, oh my gosh, I get one-on-one space to talk about this thing that I'm really excited about doing. Yes, please, right? And so I think that that's really impactful.
Yeah, it was fun.
That's great. Laurel.
I was actually trying to that sounds terrible. I was trying to come up with one that I was excited about, but I think actually, because there was a bit of disappointment as part of my project in that, like, I just didn't get as much done as I wanted to. But I do remember sort of that first time where I had like my data set was done, it was all clean, and I had gotten all the things, and like I'm like ready to run my first, you know, like regression, and I was like, I did it, I did something, I made something that works, and I, you know, and like it worked right, and I got numbers that I knew how to interpret, and you know, so that was probably like my most exciting moment of it all. But yeah, it was because it was like Lisa was saying, like some parts of it was just a hard slog. Like it was just, you just got to keep doing it, you know. So that was a good that was sort of like a little uplifting moment. Like, I did it. I made a real data set.
Yeah. No error message is powerful, right? You did not get an error message. That's a good feeling right there. And it's also okay to get through it and say, oh my God, I never want to do that again. That's a perfectly reasonable and normal response to an applied practice experience. We don't always have great experiences. My experience many years ago taught me exactly what I didn't want to do for my job. So it was like, I did this and I never want to do that again. Or in that area. And I think that's equally as impactful as putting you on the path for what you want to do, right? Those are great things. But thanks for digging one up. And I vote for that. No error message is probably a joyful moment, right? Okay, I'd love to open, I know we have a small audience today, but I'd love to open it up for a few minutes to folks in the audience if you have questions. I still have a couple more, so don't leave yet. But if anybody in the audience, you can unmute, raise your hand, use the chat function, however you'd like to ask a question. And while folks are thinking about that, I will ask the next ones. We give folks some time. So I know we talked about what your favorite part of the experience. So as we talked about how you learned about yourself, what you learned about yourself, sort of in that reflective space, is there anything you would have done differently? Reasonably, right? I mean, we can all go back and rewrite history and do something incredibly different, but given the same amount of maybe funding and resources, what would you have done? Is there anything you would have done differently? The answer to that could be no. But if there was something, we'd love to hear about it. That hindsight 2020 perspective.
I can jump in. I think the only thing that I probably would have changed, hindsight 2020, is to possibly take a little bit of Laurel's advice and start earlier. I had jumped into my experience and had to reroute at a certain point because originally I was supposed to be studying one thing and going to a conference for it. And by the time IRB got done and everything got pushed through, the conference had already happened. So I mean, hindsight 2020, if I had like, gotten in there just a few months even earlier, I think that could have presented another opportunity. I'm sure there was a reason for it. Our plates are already heavy, but just my take.
That's great. I saw in the chat, maybe we could jump to Laurel. There's a question in there about, did you go through the hospital IRB and then through the U of A? Was that the process?
So that's a good question. So one, because I was a student, I had to go through the U of A IRB for the human subject research part, but that doesn't mean that my facility just goes, okay, right? So I also did have to, we're part of a bigger corporation, so I had to go through the channels of my community health systems is who I really work for, but I had to go through all the channels for that to get I think they called it like a modified IRB, where they really are just deferring to the U of A IRB. So they're saying, okay, U of A gave you IRB status, we're going to trust that they're going to do all the things and look at your study in the way that any IRB would. So there's a special word for it, and I can't come up with it.
Deferred oversight.
Yeah, that's it.
Yeah, and we see it happen both ways. We have students who do U of A, then back to the organizations, and we have students who get IRB at the other organizations, and then U of A defers it back to them. So we've seen it both ways. Yeah,
so my company said you need to use, because you're doing it from a student perspective, you need to use the U of A one, and then we'll sign off on it.
Double the fun.
That's right.
So Laurel or Lisa, can you comment on if you would have done anything differently?
Even though I started early, I would have started earlier. and not only in I got my IRB, I think I actually got it the day of the start of the fall semester last semester. It was the same day as the first day of classes. So that was a little stressful through that process, but I again, because I underestimated sort of how long everything takes, I wish I had started all the things just earlier, done more, so I was kind of rushing at the end. And I don't mean rushing in that I did all 200 hours in 2 weeks, but that I had a lot of hours to try to get in a short amount of time. And I sort of, kind of hurt myself in that way. And that I wish I had just been a little more proactive on my timing for my, hours than I was.
That's really helpful. Yeah. Lisa.
I don't know. I think this is just with any project. I feel like, I probably could have done more. I could have met with some more people. I could have contacted headquarters. I could have done so. Whereas I think maybe that's in contrast to Laurel and Shelby. I think you all took on really hefty projects and you're saying you needed more time. I probably could have done, I don't know, but maybe that's just, getting to the end of something that you think, man, I wish I would have done this, and these other 5 things. So.
Right, but had those 5 things really been on your list, you might have been like, there's not enough time to do these 5 things.
Yeah,
right?
probably.
We can have perspective. And sometimes we don't know what we don't know, right? You get to the end and you just didn't think, wow, I could have done these things, right? They come up during the process. And then it's really, like you mentioned, trying to go back and add that back in presents its own sort of challenge.
And I'll piggyback on that question about IRB. I went through the IRB process with the U of A and was able to not need IRB because I use de-identified data, which if anyone stumbles upon a project like that, I think that does alleviate a lot of stress for a pretty short timeline. But having said that, I had to do that same process with the agency as well to say, this is what I'm doing. it is de-identified data, but they, kind of put it through their process as well to say, yes, we agree, you don't need IRB. And then once I finished everything for the presentation, because I'm, and I even have a slide as a disclaimer, I also had to have my presentation approved by our area office, as well as my paper. So there were some approvals that maybe people might not think about for certain agencies or certain workplaces, that if you're going to go and share their data or their information, you need other approvals before you put together your 12-minute presentation. Or once you finish your 12-minute presentation, they also have to approve it.
Yeah, that's really helpful. I have seen students over the years come up to that point, not realize they needed to have that approval, and they're like, oh, can I have an extension, right? So that is a really good point to make sure to share with students, that approvals don't just happen to start the project. They might have to happen midway through, because anything that you're sharing about an organization sometimes might need to go through that organization first, in the reporting phases, in the presentation phase. That's really helpful, Lisa, as a reminder. Thank you. Other questions from the audience? So I have one last question. What is some parting advice? We've heard a lot of bits here. We've heard maybe start earlier, think about the project, really give it some time, think about yourself and how you're connecting to the project. But is there parting advice you would give to current MPH students looking for a project, or even prospective students about experiential opportunity, beyond just the maybe start a little earlier, which is advice I think we all could use? Is there any other advice that you would give? Something you wish somebody had told you?
I mean, I feel like I kind of did it and lived it, but if you know what you want to do, how you want to, I don't know, get involved, go for it, shoot. It sounds cliche, but aim for the stars, right? I mean, I grew up, I'm a TRICARE kid. I grew up a TRICARE kid. I grew up in the military. I'm getting ready to go into the military. So, I mean, I knew in some capacity that's kind of what I wanted to do with my project. And so when I reached out and hit that wall, I was like, I'm going to gently not take no for an answer, in the most respectful way. So I think if you can really hone that in and, respectfully know your worth, go into it knowing that.
I love that. I'm going to gently decline your no, and we're going to find a way to make this happen. I really like that. Because especially the knowing your worth part, I think sometimes students forget that you have value to bring to these projects. Yes, you're going to be learning, and yes, you're going to rely on a preceptor and your faculty member to help you through this, but you're coming with skills, excitement, engagement, and like a readiness and a new set of eyes. And that's always really valuable, whether you're at the organization or whether it's new. If you're looking at something new and outside of your regular realm, those are new eyes. And so remember that's a really powerful piece of advice. Thank you, Shelby. Lisa and Laurel.
Do something that you're passionate about. And you're doing a master's of public health for a reason. You must be passionate about public health. So find something that you already have a strong passion for, that you get excited about. And, for me, the mission to try to elevate the health of all Alaska Natives, Native Americans, their physical, spiritual, mental, and physical well-being, that just resonates with me. And that's what I'm doing with my work. And I've worked with this patient population off and on throughout my career. So it felt really good to be involved in something that has a big impact on the population that I already want to serve. So I think looking for something that resonates with you, which it seems like Shelby and Laurel did the same thing.
Yeah, that's really important too. I think sometimes, especially as students approach that internship planning cycle, and they're like, I don't have something, and the urge is there to just take something. And I think it's really important to remember that this is a short degree. It's a master's level. Do something that excites you. Even if you're like me and you learn it's not going to continue to excite you, that's okay. Do your best to find something that really speaks to you. The work is easier to do that way. And I don't mean easy, right? It's just, it flows. And then you have this portfolio of this amazing work you did as you look for that next step in your career. Laurel.
I think I wish someone, it's hard. I had a really good experience in that it was, here at my job, and I could talk to my boss about it, even though she wasn't my preceptor. Like I had, even if it's not the person directly involved in your process, like have somebody that you can I had this group of people that I could kind of celebrate my wins, and I could just be like, if I have to do one more chart review, right? And that people who understood me, and understood sort of what I'm going through. And it doesn't have to be people you work with. I mean, it could be anybody at your preceptor site, or your husband, or your spouse, or, your teenage, your child who's in college, if, whoever. Just find somebody that you can listen to you and can help reinvigorate you sometimes, because sometimes that was also really the but you're doing something so good and this is going to be so great, and kind of like your cheerleader team, as well as your and speak, my boss is on this call because she's just one of those people for me, that she's there, and she was there for me through my project, and it was really nice to have that sort of support system. So make sure you're building that during your internship time, because it's a lot, not only class load, but internship, and, so you really need the people to kind of help boost you up a little, remind you why you got in this position.
Find your circle, circle. And I think that, also you can, so you mentioned all great people, but I think among your classmates too, you build connections with people that you did group work with, or that are in your concentration, or other connections you made to say, hey, are you struggling with this? I'm struggling with this. Can we have a coffee chat, a virtual coffee chat, or an in-person one, to say, to just vent about the chart reviews. I'm all the way done with this, right? I think that that's a really, building that circle is really important, inside and outside, because that support system is what can buoy us up when we're struggling, and celebrate us when didn't get an error message, right? When we had those wins, I think is really special. So that was my last question. Is there anything else that, if any of the audience has questions, or anything else our panelists want to share as parting wisdom?
My name is Kim Candray, and I work with Laurel. And I just want to say congratulations to you all for such a significant accomplishment. I'm sure there are days that you think it's not making a difference, but this will make a difference for you, not only today, but in your future and what you decide to do. Specifically, I want to congratulate Laurel, because not only is Laurel an amazing human, she did this with grace, and she managed a full-time job and didn't let that fall off. She managed to be a full-time mom, a full-time wife, and a full-time student. And that's a very significant accomplishment, and just congratulations. And I'm so happy for you from the bottom of my heart.
Thank you for being part of her circle and supporting her through this process. So I can tell that you've been an important influence for her. And that's not just a full plate. That's like a full restaurant of plates, right? And I feel like most of us have that, right? You see the waiter carrying 18 plates. That's what it's like, I think, for you all doing full time while juggling all these things. And so it's impressive, and we celebrate that. And that's why we're here today. So thank you. So thank you to the panelists. I'm so appreciative of you sharing your information, your experience with us. This has been recorded. It'll be on our YouTube channel, so folks can watch it who weren't able to join us today. But I'm going to pass it to my colleague, Mariah, who's going to wrap us up.
Yes. So just to reiterate, thank you everyone for attending today. Thank you to Kim for moderating and our presenters for this discussion. We want to thank all of our wonderful applied practice experience sites and preceptors with whom we've been working to improve public health. I believe Vanessa is going to put it into the chat, but there's a link to a feedback form for this live event. We would appreciate if you could take a few minutes to complete that form to help us make this event better each semester. We also want to encourage you to view the APE conference webpage to see this semester's MPH student presentations and how they're helping move public health issues forward. They have all worked incredibly hard on their applied practice experience projects, and the virtual conference page allows us to showcase projects from all of our campuses together in one place. These presentations recordings are being hosted on a webpage on the College of Public Health website, and we'll post that link in the chat as well. Presentations will be viewable in an on-demand format until Monday, August 2nd. We encourage you to watch as many presentations as you can during the viewing period. For each presentation you watch, we also ask that you fill out the presentation feedback form linked on the presentation viewing webpage. But we have now come to the end of this student highlight event, and we sincerely appreciate you all once again for joining us this afternoon. I want to thank the student panelists again, and we hope you enjoyed watching the student presentations, and have a fantastic day.